Well, hello and welcome to the Vocal Appetite. So this whole course, or this actual video, is based on breathing, diaphragmatic breathing. So this actually means just breathing in and out from your diaphragm area. What people tend to get wrong is, or not wrong, what they're used to is that they need to feel the need to raise their chest and shoulders when they breathe. But when you're singing, it's very different. I mean, even in normal life, you should be breathing from your areas of your belly or your abdomen. But what you tend to do is raise your chest, thinking it's the right way to breathe. What you're actually doing is making it harder for yourself to breathe because you're not filling up your lungs fully. So you're actually losing 25 to 50% of breath of air going into your lungs. So this is why this area here, just where your ribs are, just the bottom part of your ribs, to expand out for the lungs to be filled with air. So when you're breathing, it's the techniques. So if I turn sideways, you'll be seeing this. Now, of course, when you're actually singing, you don't want your belly to come out. Hence, you have to get your abdomen areas over here to work. So there's different techniques for that. One is actually breathing all your air out. So having one finger, just have a little gap between your mouth and your finger and your index finger, and blow out quite forcefully where all the air is pushed out. And then breathe in quickly. Now you saw how that worked there. That works so well. I'll not do it again so you understand. So breathing all the air out from your diaphragm and from your chest, the whole area to be clear. Yes, all the air is to come out. And now breathe in. So that's one technique you can use, which actually is quite helpful. And this is how I learned to actually breathe from this area here. It can be difficult, so please do be patient with this. Take your time, but make sure you do it properly and don't get frustrated if it doesn't go right a few times. Just focus on the task at hand, right? And the other way you could do this is other techniques you can use. So you can use, like, you're sucking in from a straw. So, or the same thing works from the sides. We see a different sound it makes. It makes a lovelier sound from this area. But first focus on here if it's easier for you. And the last one is basically having the air hit the back of your throat. So, and if you want to get the technique right, you can always breathe. It's easier to breathe from this area with your mouth closed and breathing in from your nose. But what you'll get there is when you're singing, that is not possible to do. So this is why you have to get used to using the same method to actually breathe in from your mouth. So same method, but this is going to do the same work. So I hope that's helped a little bit in terms of breathing. Again, as I said, it will take a bit of time if you're not used to it. But every day when if you're gymming, if you're walking, whatever you do, make sure you try consciously to breathe from here, from that area. And make sure you make it as first nature, if anything. Right, that's it from me. Wait for my next course.